Everyone, Steffi here, Confidence Guru, and like I like to start off all my videos explaining that I have a lot of animals. So if you hear some background noise like birds chirping, cats meowing, dogs barking, or pigs oinking, that is where it's coming from, is my mini pets. Today I'm going to do a book review of one of my most favorite books. It is a book review that's going to be especially for my friends who have chronic pain conditions like I have. Okay, the name of this book is The Pain Cure, the proven medical program that helps end your chronic pain. It is by Dharma Singh, Khalsa, MD, with Cameron Stout. All right, now I believe that I have done a book review or a real quick book review on this before, but it's not on my YouTube channel, so I just wanted to make another one so that that everyone is up to date on this, because I really think it's an important book, and I'm going to go a little bit more into detail this time, so bear with me because this is going to be kind of a long thing, but you really want this information. First of all, let's talk a little bit about the author, Dharma Singh Khalsa. He is an American physician and medical researcher born in Cleveland, Ohio. He graduated from Creighton University, the University of California, and he did studies at Harvard. He established the first holistic pain program in the southwestern United States at Lovelace Medical Center in Albuquerque, New Mexico. And he was the founding director of the acupuncture, stress medicine, and chronic pain program at the University of Arizona. Although he is most widely known for his research and treatment of Alzheimer's disease. He's really making strides in that field specifically. Okay, now to get into a little bit of the book, I wanted to read a little excerpt from the front of the book that shows you that he truly understands how we feel and where we're coming from. It reads, "Chronic pain is the most devastating physical malady that exists. It's even more overwhelming than having a terminal illness, according to patients of mine who have suffered from both conditions. If you're a pain patient who is reading this page right now, you must certainly be strong, because you're still trying to find a way out of your suffering. Despite everything, you still have hope. I salute your bravery. In my eyes, you're a hero." So that shows you that he truly understands what we're going through. A little bit here, he talks about how he's going to go a little bit into how the book, how he came up with the name for the pain cure of the book. It says, "Pain and suffering are different things. Pain is a physical sensation, and suffering is one possible reaction to that sensation. It's possible to experience pain without suffering from it. When you learn to experience pain without suffering, you will be set free. When you reach this point, your chronic disabling pain for all practical purposes will be cured." So that's what he's talking about. When he talks about curing your pain, your chronic pain, it says it's when you learn to experience pain without suffering, that's when you're going to cure your pain, okay? Now let's see. He goes into a little bit about what the chronic pain syndrome is. Chronic pain syndrome is a group of physical and mental characteristics that often accompany chronic pain. It consists of negative behaviors and attitudes that gradually pull pain patients away from their lives into a ceaseless whirlpool of pain. Chronic pain syndrome greatly magnifies the physical sensation of pain. Okay, so chronic pain and chronic pain syndrome are two different things. The next thing he does is he's got a list of questions, a questionnaire to figure out if you indeed have chronic pain syndrome. And this book is aimed at people who have the chronic pain syndrome, okay? So this is going to be an important tool that you use in figuring out if you have it. So after that, I have some other stuff highlighted here. Chronic pain syndrome, which is caused by pain, also causes further pain, okay? So this is what contributes to the cycle of pain that we get in with the chronic pain syndrome causes further pain, and further pain causes chronic pain syndrome, and so forth, and it just goes in this circle. To break this cycle, you need to follow a careful, constructive program that he has outlined in this book for you. Okay, that's what the book is about. His pain program consists of 4 fundamental treatment levels, and each of them helps break the cycle of pain and eliminate chronic pain syndrome. The first level is the nutritional therapy. Now, this includes dietary modifications and ingestion of specific nutrients, and this is going to be in the form of vitamins and stuff like that, herbs and different things like that you take, okay? The second level is the physical therapies, and this includes exercise therapy, acupuncture, massage, light therapy, magnet therapy, chiropractic, and advanced yogic mind-body exercises. That is a specialized form of yoga, and he's got a whole section in the back of the book that goes through those, and I do those, and it has really helped me out with my chronic pain. All of this has helped me out. The third level is medication, and this includes pain medications, nerve blocks, injections, and brain enhancement medications. Now, see, a lot of people might think, oh, this is just a natural treatment, but holistic does not mean just all natural. It means coming at it from every viewpoint, and that's basically what Dr. Dharma does in this book. Is he brings the Eastern and Western medicines together and helps create something that just knocks out your pain from so many different angles. The fourth and last one is mental and spiritual pain control, and this includes stress reduction, treatment of anxiety and depression, psychological therapies, and spiritual development. All right. Now we're going to get into a little bit of how pain works. Pain travels along a complex pathway in the nervous system, and all along that pathway are, in the nerves in the brain, are these biological gates that can be closed, okay, to shut off pain. When these biological gates are closed, the pain is reduced or eliminated. This concept is called the gate theory. Chronic pain and acute pain are 2 different things. Short-term acute pain often comes from it's almost always a symptom, and it's a warning that something has gone wrong. Chronic pain is generally not a symptom. It is a disease within itself. Most chronic pain is caused by a malfunction of the nervous system, the nerves, and the brain. To a large extent, chronic pain is in the brain. This is not to be confused with it being in your head like you're a nutcase, okay? It's very different. We are talking about the physically, the compounds of your brain and your nervous system and the chemicals and the neurotransmitters and all that jazz, okay? Which I'm going to go into right now. This is what happens when you get an injury. This is the pain cycle and how it works. All right, when you get an injury, neurotransmitters ship the signals to your brain. The body forces these pain chemicals to travel through the pain gates that I was talking about earlier, and so that our brain doesn't get overwhelmed by so much pain. So as it goes through each one of these gates, it mutes it a little bit more and more so that it's not so overwhelming to our brain. Once the signal reaches the brain, it decides how serious the pain is, where it's located, what it means, and how to deal with it. If your brain decides that your signals aren't that serious, it tells your body to relax, and it pumps out a calming brain chemical called serotonin, which I know you've probably heard of because all antidepressants are serotonin reuptake inhibitors, and serotonin is just an overall very important part of your body chemistry. This causes the pain signals to calm down, your blood vessels to loosen up, and the muscles around the injury to relax. However, if the brain decides that the signal is a serious problem, an all-out counterattack happens. Adrenaline is released instead of serotonin, and the blood vessels constrict, your heart pounds, muscles tighten around the injury, and your nerves go on edge, just waiting for the next pain signal, waiting to find out what else is wrong. This is when things can go wrong and chronic pain can begin. If your counterattack is too strong or not strong enough, chronic pain can set in. And he goes much more in depth in this book about chronic pain and all the things that contribute to it, and then in essence, how to treat these different things. Now, like I said in the beginning, there were the 4 different levels. Remember those levels I talked about? I'm going to go into those just a little bit. This book, I want to show you how thick this book is, okay? That's a lot. That's a lot of information, and I am just skimming the surface for you. Okay, level 1, the nutritional therapies. The first thing he's going to have you do is eat nutrients that relieve inflammation, nutrients that build pain-blocking serotonin, nutrients that boost the health of your brain and nerves, and things to avoid that are classic dietary pain pitfalls. Okay, so what he's going to do is he's going to tell you these foods to eat and these supplements to take. They're going to do all those things, okay? Relieve inflammation, build serotonin, boost the health of your brain and your nerves, because that's where the pain lies, okay? The next thing that he has you do are the physical therapies. And this chapter goes into those. One of the ones that I find most interesting is the exercise therapy. Now, a lot of you are saying, okay, I can't exercise, but your workout only needs to be intense enough to raise your heartbeat by 50%. For some of us, that might be laying in bed and raising our legs or doing something simple like that. It does not have to be hardcore. It just has to raise your heartbeat by 50%. Now, what is this going to do for you? Well, your exercise is going to boost the output of endorphins, which is like your body's own little source of morphine, okay? It's going to increase the brain's supply of serotonin. Remember, we were talking about how important that is. It is going to increase the levels of norepinephrine, which boosts the mood and energy. It's going to help stabilize your levels of estrogen, which can interfere with serotonin. Okay, too much estrogen can interfere with serotonin. Exercise also is going to improve the overall functioning of your brain because, remember, pain is in the brain. All right, the next thing that he's going to go over, the next chapter, is going to be the physical therapies. Oh, wait, no. We're still on physical therapies. Oh, that's right. Exercise therapy is just one of the many physical therapies. The other ones are light therapy. That one, you may have seen me post on my Facebook yesterday about the light therapy and how important that is for releasing the serotonin. There's aromatherapy in here and the mind-body exercises. Okay, that's the yoga, the specialized form of yoga that is in the back of the book. Like I said, it's really, really easy to do. I do the ones that I can do. There are some that I can't because it kind of pinches like my kidney or something that hurts. And so these are ones you're able to do. All right, the next one is medication. That's level 3. He's going to talk about pain medication, which we all need, but it basically what it is when you are doing all these other things, it helps your pain medication to be more effective. So if you're one of those people that you just have to keep taking more and more and more pain medication, you need to, this will be a really good book for you. Cognitive enhancement medications and condition-specific medications, okay? That's going to be for the specific chronic pain conditions that you have that might treat that. All right, now, level 4, the mental and spiritual pain control. This is probably the most controversial part of the book because in this book, he takes off the kid gloves and just tells it like it is, okay? He's going to tell you how to have a positive outlook, and he's going to tell you the importance of visualization, meditation, stress reduction, and using other mind over matter techniques. This is where you've got to pull up your big girl pants and just get over yourself. That's a very good way of putting it, is to get over yourself, to stop whining, stop complaining, and think positively, okay? He also is going to bring up the subject of rising above pain with spirituality. Now, this can be touchy, okay? Because some people are going to say that spirituality has nothing to do with it, but he's going to show that it's not about necessarily about your God or whatever, but just the overall spirituality of life, okay? And because that was one of the things that I was kind of like, how he has different spiritual beliefs than me, so but that's not what he's talking about. He's not talking about religion, okay? He's talking about spirituality, which is something completely different. All right, and the rest of the book goes into the specific conditions. He's got arthritis pain, headache pain, back pain, fibromyalgia pain, and other conditions such as cancer, irritable bowel syndrome, TMJ, carpal tunnel, and premenstrual pain. These are all the things that he goes into the little specifics, little like sub chapters, and he's talking about how to specifically treat those individual problems. All right, that is my review of this book. I hope that you enjoyed it. And the most important thing is this part. The program described in this book is not intended to be a substitute for medical care and advice. You are advised to consult your healthcare professional with regard to all matters relating to your health. So, talk to your doctor first. Thank you, everybody. Have a good day.